All right, we're going to start, and let's see, Terry, you're going to be our opening, and then I'll come on right after you and welcome everybody, and then introduce Vanya. Vanya, will you put your complete name on your screen there? Okay, stop. It's okay. We're going to go with what we got. Okay, I'm starting now. Dr. Bird, you will be up first.
Recording in progress.
Good morning, everyone. My name is Dr. Terry Bird, and I am the president of the National Congress of Black Women. I would like to thank you, first of all, for being here with us on today as we discuss a very important topic, mental health. We know that mental health matters, and the Mental Health Matters webinar will focus on the impact that COVID-19 has had on the mental health of both women and children. And it is our hope that you will understand how COVID-19 has caused an increase in mental health issues, and also learn how to support women and children as they navigate the issues of mental health. Again, we want to thank you for joining us, and we look forward to a very informative webinar. And at this time, Dr. Bester will come and welcome you.
Good morning and welcome to the Southern University Law Center. On behalf of all of our, first of all, our Chancellor, John Pierre, and all of our faculty, staff, students, and alum, we are very proud to have you with us here today. We have a very, very special moderator who has agreed to join us on today. She is a native of Florida and of Haitian descent, which we're very proud to have her here. She's very proud of her heritage. She's coming to Baton Rouge, and she's only been here for 4 months, so we want to say a very special welcome to Ms. Vanya Joseph. Take it away, Ms. Vanya.
Okay, great. Good morning, everyone. I believe we have a prayer before. Is that correct? Do we have someone giving a prayer?
I will do the prayer. Okay. If you will bow your heads. Father, we thank you for today. This is the day that you have made, and we thank you, Lord, that you have purposed for us to be a part of this. And as we come today, God, we lift up all of our presenters. We lift up every participant. We ask that you will take this information to the heart, to the mind, to the souls of those that will be participating, and that we know that it is your desire that we be in health and that we prosper even as our souls prosper. We pray that the information shared here will help somebody to get back on track, to get the help that they need and be restored. And we thank you for everyone, and we pray this prayer in Jesus' name. Amen.
Amen. Amen. And if I may have screen share, please.
It should be at the bottom of your screen, Alma, right next to
disabled. It's disabled.
Okay, let me get it for you.
Okay, so while Frida is pulling that up, let me just go ahead and introduce myself. My name is Alma Stewart. I'm president and founder of the Louisiana Center for Health Equity. And I am a member of the National Congress of Black Women. Very pleased to be here and to be among this distinguished panel of presenters. So I will go to my, okay. All right, great.
Alma, I've made you
Yes.
host. Whenever you're done, then you'll give it back to me.
Great, okay. Okay, so can you all see my screen?
Yes.
Great. Okay, well, we're going to go through fairly quickly in the interest of time, but I did want to just, I've already said who I am, just share with you a little bit about the importance of emotional well-being and mental health for women, to talk a little bit about the impact of COVID-19 on emotional well-being and mental health, especially for children and women, and then discuss opportunities to improve emotional well-being and mental health for women with a call to action. So I just want to start off with some very poignant facts. 22.7% of Louisianans report experiencing frequent mental distress, which is higher than the national average, as you can see. And the rates of mental distress are higher for women than men, higher among adults 25 and older with a household income of $25,000 or less, and for adults 18 to 44. So you can see the demographics there that are experiencing more frequent mental distress. And as you can see from this chart, and why this webinar is so very important and timely, is that mental distress is increasing by education. You can see that here that it's it's broken down by educational level. And regardless of what educational level you have, it is increasing. So across the board, college education, less than high school, frequent mental distress for everyone, pretty much all demographics, is increasing. Depression rates have increased also. So all of these data, and I'm going to go real quickly through them, but the message that I'm trying to show you with the graphics is that mental health is very important, because across the board, people's mental health has declined or worsened over the last few years. So you see by women, gender, women, men, the breakout there. The blue is women. You can say it's much higher for women than men. You can see by race that the blue is actually American Indian. The green is actually Blacks. So you see, regardless of what race you are, the only race that has not had an increase and that has had a decline is American Indian as it relates to race. And with regards to health disparities, 33%, there's been a 33% increase in depression in adults with a high school education between the years that you see shown here. So another point that I wanted to make in regards to just the overall well-being, mental health and well-being, we're also seeing more drug deaths. And so you see here that drug deaths have increased 34% over the past few years as well. This slide just shows that in addition to the impact of mental health decline and the fact that people are struggling emotionally, suicide among adolescents has also increased and is increasing. You can see on the graph here that shows for Louisiana and for the United States, Louisiana is the bar graph with the circles around it. You can see that overall, the trend has been up for suicide among 15 to 19-year-olds. The other graph just shows women and the women that report mental health, that their mental health was not good for 14 or more days in the past 30 days. And that again is women ages 18 to 44. So if you're within that age range of 18 to 44 and you're a female and you're a Black female, you're probably not, we are struggling more than other demographics, let me say it that way. This slide, This slide just shows a little bit of information about the COVID-19. We're going to talk about the impact of COVID-19 on women and children. We have had, as of November 11, 763 cases and 14,000 plus deaths. And most of us know at least someone who has died of COVID-19. More women are impacted by COVID-19, 55% as opposed to 45% men. And I just wanted to speak for a moment about the impact of COVID on women and children. On women's mental health, on maternal mental health. We are also seeing that because of the social isolation with the stay-at-home orders and just the social distancing and all of that, we are seeing that more women are really, maternal health, in terms of women's maternal health, has been impacted as well. Unprecedented unemployment rates leading to financial and emotional strain. More women are outside of the workforce because of COVID, and in some instances because of having to stay home to take care of children. And so it is associated with increased risk of developing what's called perinatal anxiety and mood disorders, of which postpartum depression is one of those PAMDs. The isolation and decreased social support increase the risk of developing PAMD, especially postpartum depression. So I'm just going to skip through some of this. You can see it here on the screen and just summarize this by saying relationships and financial stressors associated with COVID-19 place women at increased risk of postpartum depression. And I don't have a slide that really talks about it, but I also just wanted to mention real quickly that another impact is also we see an increase in domestic violence. There has been clearly an increase in domestic violence over the course of the last couple of years as we're going through the COVID-19 pandemic. So I want to talk a little bit about a response and what we can do, what effort we are putting behind trying to address all of these issues around women's health. We're focusing on mental health, so we didn't talk about the other aspects of women and women's health, but I wanted to share with you a little bit about the campaign to establish the Louisiana Office on Women's Health, which is still ongoing. We launched this campaign earlier this year, and this is just a visual of some of the members. Not all of the members are listed here, but we have over 50 plus member organizations, and we are still accepting more partners to sign on to the campaign. Our vision is to improve the health outcomes for Louisiana women and to foster a better quality of life for women and their families. And we want to get this office established by the end of 2022. Our goal initially was to get it this year. We got very close to it. I don't have time to go into the details, but getting to the Senate Finance Committee with Senator Bodie White stopped it dead in its track after having unanimous support from the entire legislative body that had the opportunity to vote on the legislation. So we will be back next year with that legislation, and I believe that we will be successful. And I don't even need to say any more about why it's important. I think that you all know very clearly, just even based upon the demographics and data that I've shared with you on just the mental health status of women. And that's just one aspect. When we look at the physical health, it is also declining. We see the same kinds of data that we are just faring. Morbidity is also getting worse. We're sicker than we were before. So this office would coordinate women's health efforts and address critical women's health issues, such as those we've already mentioned. It would position us to be able to take advantage of the federal initiatives and grant funding. And this office would also assist in improving the birth outcomes, which are dismal. Probably the worst indictment for Louisiana is the birth outcomes that we have in this state. Reducing chronic diseases and alleviating health disparities. Don't know why I'm having trouble with that word. As well as lessening the burden on the healthcare costs. The cost of us being unhealthy is increased to the state. If you're interested in signing on, here's the link to sign on to become a member of the campaign. We are still, as I said, accepting members. We also have a petition where we are gathering signatures, and we are, I believe, over 6,000 signatures now, but our goal is to get to 10,000 or more. And so we are definitely asking for your help to promote this petition to establish this Louisiana Office on Women's Health. Please do sign on yourself and share it with your friends and colleagues. These are just the references. And with that, I am going to turn it over to Dr. Patrice, who is going to talk to you more about the actual impact on real people. I would ask that if you can put in the chat for us or email us at this, email me at this email address, alma@LA Health Equity, if you're interested in being a part of seeing Louisiana move forward and creating a better quality of life for all women in this state.
Yes, yes. Good morning. Good morning. Just access to share my screen. But thank you, Alma, for sharing those really startling numbers. And so I don't think it's any surprise the state of our mental health. And so I'm going to, dive right in, because we not only have a problem with that statewide, locally, but it's a global epidemic when we talk about mental health and mental health concerns. And so I'm still waiting to be able to share.
You have it now.
Okay, great. Okay. Okay, can you all see my screen?
Yes.
Okay, all right, great. Good morning. Well, why does mental health matters? And so I am Dr. Patrice Centino. I am the CEO and owner of Center for Hope Children and Family Services, which is an outpatient mental behavioral health agency. We service children, youth, and adults and families at whole. We have 2 locations where we service the greater metropolitan area as well as St. Tammany Parish. I am also assistant professor in the School of Social Work at Southern University at New Orleans. And so I just wanted to give a definition. The World Health Organization actually gives a definition on mental health. And basically, mental health is a state of well-being in which an individual realizes his or her own abilities, can cope with the normal stress of life, can work productively, and is able to make contribution to his or her community. And so oftentimes, we don't consider mental health as a part of our overall health. And so we want to really shed light and be informative about, if you don't have mental health, you really don't have health at all. One of the great sayings by C.S. Lewis that I really like is mental pain is less dramatic than physical pain, but it is more common and also more harder to bear. And so yes, and so with the COVID-19 pandemic, we saw really a uptick in mental health. And so the stress of the pandemic really exacerbated a lot of folks that were already suffering with various different neurological, mental and behavioral health issues. So if we take a global perspective at looking at mental health, there are over 450 million people that suffer with mental health. And so whether that's anxiety, whether that is depression, schizophrenia, and basically we saw a lot of mood disorders people that were suffering with mood disorders, we saw a lot of them become affected with mental illness. And so similarly, with any type of, world natural disaster, whether it is, epidemics, earthquakes, fires, whatever it is, with natural disasters, even after Hurricane Katrina that occurred in 2009, the prevalence of mental health and domestic violence quadrupled, and it doubled in women particularly. Alma referenced how women suffer more greatly than men, but it doubled almost. It went from about, I think the percentage CDC quoted was 4.2 to almost 9% after Hurricane Katrina. Folks that suffered and their mental illness increased. And so we want to make sure that we take a perspective and a global perspective about mental health, and particularly how disproportionately Black and Brown people, Indigenous people were affected due to the COVID-19 pandemic. We also saw an uptick in intra-family violence that went on during this pandemic time. And so 300 million people are affected by depression. 60 million people are affected by affective disorders, behavioral affective disorders, bipolar. This slide here just basically gives just some little information about the various different statistics as it relates to men, women, and I'm not going to go over all of the details, but basically 35% of females have moderate to severe levels of depression compared to 19% in men. So you can see that women are drastically affected. During lockdown, women were significantly more likely than men to have felt nervous, 40%. Everything was an effort, lonely, 28 to 16%. And then if we talk about the widening gender gap and the negative health impacts on coronavirus, we can see basically the various different totals. And so I don't know if you could see the bottom screen, but this column, women and men. And so you could see 53% during the time period of March 11th through March 15th was really kind of like the onset of the COVID-19. You saw really a dramatic increase of the impact of people's mental health. And then parents of children under the age of 18, you saw that spike goes even higher, 57% with women. And so the Baylor University, they did a actual study, and it looked at the gender, it was a gender gap analysis. And so they looked at the various, gender gap and how the COVID-19 affected the lives of men and women in over 38 countries. And the number of women that was reported was extremely higher. And so women reported they were more stressed, had more anxiety, they had other issues that they struggled with. And so we saw more women, right, that were the labor issues, they were on the front line. And so all of these things played really a significant impact on women's psychological state. And so, and also the numbers increased again with home family violence. And so me, being a clinician, I saw many families, I counseled many children, adolescents, mothers that were really, suffered with depression due to, school closures, stay-at-home orders. Mothers were disproportionately more stressed with the responsibilities of homeschooling. And so, all while trying to manage their own, as I said earlier, psychological distress. My screen kind of froze. Okay. Okay, so let's talk a little bit about how the COVID-19 pandemic increased suicide rates among children. And so here are some statistics. Among girls aged 12 to 17, between the time period of February to March 20th of 2020, we saw an intake of increased intake of children coming in with potential suicide attempts. They were up at least 50%. And then between the months of July, August, we saw 26.3% spike in suspected attempts. And so I definitely want to make the delineation, because sometimes we make the mistake of really classifying self-harm and suicide as one and the same, but it's very different. It's not one and the same. They're very distinctly two different things. But one particular study that I looked at was done by a nonprofit organization called Fair Health. And Fair Health looked at 32 billion private records of claims of tracking data of children that went into the hospital from basically January to November of 2020. And so that number really spiked. And so it showed an overall increase in insurance claims among the ages of children 13 to 18. And so that number was almost 119% higher than the year before. And so that is startling, to 100% increase of children that went into the hospital. And so even comparison from August 2019 to August 2020, in certain parts of the Northeast section of the United States, from 13 to 18 ages, it was almost 333% increase of claims that were tracked. And so I want to make the point that was private. So what happens to our people that are disproportionate, that doesn't have access to health care, or that are on Medicaid? And so we could see that that number is even higher. And so why do people harm themselves? Why? And so I just want to, people harm themselves for very different reasons. And so it's not always easy to discern between non-suicidal self-injury behavior or suicide attempts, right? And the only way we can really know is to ask a person directly. Are you having thoughts of suicide? Are you wanting to kill yourself? And so, really a person who is experiencing suicidal feelings, they really are trapped in a place of hopelessness. They feel like there's no way out. They don't have a sense of purpose. And so they withdraw from family and friends, their mood changes. And so they even talk about death and dying, but that is suicide. But however, when we talk about self-injury, on the other hand, this is a non-suicidal behavior that serves really as a coping mechanism for a lot of children. And so it may relieve them of some unbearable emotional anguish or numbness, or, and this can go on for weeks or even years, but oftentimes this mental illness is really a psychological distress that needs professional treatment. And so oftentimes you'll see kids that may cut themselves or scratch themselves or burn themselves. And it's really to get some, and definitely can't go into all of the neurological aspects of self-injury, but we have these endorphins. And so when they self-inflict pain on themselves, it gives them a sense of euphoria. And so it relieves that pain for that period of time. But how can we help people who are self-harming? One, we want to be non-judgmental. We want to encourage them to get help, reassure them that you care, and reassure them that there is people out there that want to help them and see them succeed. And so how do you get help? And so there are many ways you can get help, right? And so talk to your doctor. That's very important. We want to remove the stigma that mental health is a disease, or it's classifying you as crazy. Mental health is a part of your health. So we want to remove that stigma. We want to do more awareness and education. And so we want people to reach out to other people and also seek mental health information. And so that is why we are here today, to provide this information to the greater community, because mental health is a part of your health. And so the importance of mental health, I would like to leave you with this, is relation to overall health. Our mental health encompasses our psychological, emotional, and social well-being. This means it impacts how we feel, think, behave each day. Our mental health also contributes to our decision-making process, how we cope with stress, and how we relate to others in our lives. And so I just want to leave you with this. And so we see with all of the numbers, the statistics that Alma shared, that I shared, we have a lot of work to do in this area. Thank you.
Good morning. My screen share is disabled. Good morning, everybody. Miss Alfreda, if you can give me screen share.
Dr. Centino, would you please give the hosting duties to Miss Tilly, please?
Well, my name is Emily George Tilley. I am a licensed clinical social worker and a licensed addictions counselor. I am going to talk about addiction and how COVID has the impact of COVID on women dealing with addiction, because that's what I do. I am the clinical director at O'Brien House, and I am the owner of EGT Counseling and Consulting Services. So how has COVID changed us? What I've seen is that COVID, as the country tried to adjust to a global pandemic, a lot of people folded under pressure. And when we speak about mental health, we can't forget that addiction is a mental health disease. So people were trying to adjust to the new realities of working from home, being unemployed, having to homeschool their children, lack of physical contact with other family members, friends, and colleagues. It takes a lot of time to get used to. If you're a person who's used to being out in the community and doing things, and then you're shut down, you may fold under pressure. So you have to adjust to the lifestyle. So what is addiction? A lot of people don't really know the definition of addiction, and the American Society of Medicine defines addiction as a primary chronic disease of the brain, reward, motivation, memory, and related circuitry. Dysfunction in these circuits lead to characteristics, biological, physiological, social, and spiritual manifestations. This is reflected in an individual pathologically pursuing reward and or relief by substance use or other behaviors. So many people use illicit drugs at the experimental or recreational stage. Then it becomes a personal choice, but eventually a psychological based dependence sets in. When that dependence sets in, it significantly alters your brain chemistry. And then there's a variety of complex reasons of progressions to the problematic phase. Some people relate addiction to hereditary genetics, your psychological makeup, or your social lifestyle, or environmental factors. And in the case of COVID, a lot of people who maybe have had some more recreational use, because their environmental factors change, they started to get into that dependence and abuse phase of addiction. So why do people take or use drugs in the first place? To feel good, or to feel good or to feel better. You want to reduce your anxiety, your fears, depression, hopelessness, or you're trying to get a sensation, that euphoric feeling that drugs gives you for a temporary moment. So a lot of times, because of COVID and we were so isolated, people became more dependent on drugs or started to have problems, or problems increased because you were being isolated. You weren't being around a lot of people. So family members were not seeing these signs of addiction. The physical signs, which is the bloodshot eyes, the nosebleeds, changes in appetite, slurred speech, depending on the type of drug that you're using. The behavioral signs, which changes in your performance. Well, because a lot of people were working from home, you're not seeing that a person is probably not doing everything that they're supposed to be doing because they're at home. It's different from being in an office. Financial problems. Because of COVID, some people were unemployed. There was not a lot of access to resources at the beginning of the pandemic. So, that causes a stress on someone unlike anything else. Loss of interest in activities, which is very easy to do when you're isolated and you can't really do anything. So you don't find pleasure in activities because you can't do the activities that you're typically used to doing. Psychological signs is your change in mood, lack of motivation, agitation, or excessive energy depending on what you're using. So for COVID, as a recent study, they found that there was an increase in the number of people primarily drinking and using prescription drugs because they were home, they had more access to doing those things. So as we see, the pandemic, it was a growing problem. There was an increase in use caused by an increase in death and overdose, as my counterparts have explained earlier. For a lot of women, access to treatment was already difficult for women. There primarily more facilities in the state of Louisiana that service males over females. One, there's a lot of barriers with women because women come with children. Most times when, women have an addiction issue, if they have small children, there are really only about 4 places in the state of Louisiana that services women and children. So it's hard for a woman to say, let me go to treatment if I'm the sole provider for my children and I can't take my children with me. So, and with the isolation and the shutdown, a lot of treatment facilities closed. There was a lot of loneliness, confusion, and unemployment. People in recovery, support groups and human contact is a vital part of being in recovery, stopping the use. So not being able to have that support or that human contact caused a lot more angst and depression and anxiety, and you couldn't get that human contact you needed to possibly stay clean and sober. Or you have a fear of contracting the virus, so you weren't going to treatment. You were not going into facilities because you had a fear that, okay, I'm going to go into this facility where I could possibly be around someone who has COVID. So that kind of put a halt on people getting treatment, especially women, because they already had a barrier, but now we have this additional barrier because I can't send my children to live with someone else because they may have a fear of contracting the virus from my children. So I'm not being able to relieve that pressure to have my children cared for while I go to take care of my problem. So how do we cope with that? One of the things as a clinician that we had to do, especially for our women who were already feeling some depression from being away from their families and not really having a lot of contact, was we had to keep them away from watching the news, reading, listening to hearing about COVID all day, every day. It caused additional anxiety. Making sure that they're taking care of their bodies, helping them to understand meditation, having a healthy, well-balanced diet, exercising, getting plenty of sleep, definitely trying to help them to avoid excessive use, educating them on the strain that alcohol and tobacco use has on their body. And now our biggest push right now is getting them all vaccinated, making sure that they can eliminate that fear of contracting the virus if they get vaccinated, and they'll feel more comfortable going into public spaces to deal with their addiction. And I just wanted to leave some information for anyone, if you are in a crisis, to get help immediately. These are just some numbers and hotlines that you can go to for whatever it is you're suffering from or dealing with as far as your mental health is concerned. Thank you. So I can speak as a child of two addicted parents. One way is to educate yourself. Growing up in a household with both my parents were on drugs, I had a drive to do the right thing, go to school, get an education, not, go out and party or not party to excess, because growing up, I thought, okay, well, if my parents are like this, then I'm gonna be like this too if I do not stop the cycle. So it's all about education, having a good support system. Even though I was in a bad environment, I had good people around me that kept me out of trouble, kept me involved as a child. That early education is very important for you to understand what addiction is and how to learn better ways to cope, because most times people become addicted because they are using drugs and alcohol to cope with a trauma, depression, anxiety, the stress of life. If you can learn healthier ways to cope other than drinking or using drugs, then you can, stop that cycle.
I think when we're talking about identifying depression in women, there's oftentimes you have to look at changes, right? Changes that happens within your body, physiological changes. And so mood changes. And so oftentimes women are very emotional. And so we know when we have something that upsets us or our moods are changing. And so oftentimes clinically, you have to observe that mood change over a period of time. And so before a clinical diagnosis can be given. And so monitoring that behavior, being aware and in tune and attuned to our bodies is so important. And so, if we're easily upset or something triggers us, it rings off an emotion that we normally didn't have or would have reacted or responded that way. And so if we're noticing these changes in behavior, I think it's important to seek professional help, seek counseling, seek out someone to talk to about these issues or concerns. And so, women sometimes wears the weight of the world on their shoulders, and they feel like they have to continue to push, right? But they're also the ones that's suffering in silence. And so we shouldn't have to suffer in silence. And so just like Emily said, education is so important. And so I'm so excited about the Office of Women Health, because we need that. We need that. Women need to be supported in this space and in this area. Yes. In the same with, with the same with children. Children were, alarmingly disproportionately affected due to the COVID-19 pandemic. Children are naturally engaging, right? They want to be with their friends. And so when we saw the lockdown, we saw children that had to be homeschooled. We saw children that really weren't, efficiently homeschooled because of technological, not being tech savvy. The parents were not technological savvy. That increased stress in the home as well. And so the best thing that parents can do is, make sure you observe your children, making sure you're checking in with your children, checking in with their teacher to see how they're performing. We saw a lot of kids, the learning gap decrease because of the time that they were out of school. And so checking in, doing a feelings check with your children. How do you feel today? What went on today? Was it anything that upset you today? The most important thing is checking in with your kids. And so oftentimes as parents, we're super women, we're super dads. And so we're trying to make things work. We're working. And so we often really don't see the signs until they're too late, until they're self-harming or they're suicidal. But it's, education and checking in with your children is very important.
And one of the statistics that I showed, if I may chime in here, was on teen suicide and the increase in teen suicide. But also although we didn't go into it as much about children, the mental health and well-being of children has also declined. And there is a lot more anxiety, a lot more depression, a lot more suicidal ideation, as well as the increase in actual suicide. So it is very important, and I say this to parents, especially parents, grandparents, friends, neighbors, everybody, please pay attention. Because oftentimes, children especially will suffer in silence. And we have asked some children, why don't you go to your parents? Why don't you tell your parents what you're feeling and what you're experiencing? And their answer is, I don't want to burden my mom. I don't want to burden my parent because they're already struggling too. And so they suffer in silence and to the point sometimes of no return. So parents and other loved ones, please pay attention to those signs and changes in these young people too. If they're sleeping all the time, they don't want to go anywhere, they don't want to do anything, that's a sign that they're depressed, that they're struggling, and it needs to be addressed.
And as Dr. Centino stated, that open communication, I find I have a 4-year-old, so I'm very expressive with her. I tell her I love her. We do affirmations every day because I don't want to have the same relationship with my daughter that as a teenager I had with my mother. I was one of those kids who I'm not going to tell her what's going on with me because I know she has her own stuff, but I find it's very important to make sure that as a parent, you have the lines of communication open. No, you don't want to be their friend, but you want to make sure that you have a relationship enough to where they trust to come to you. And if they tell you something, that you're not going to badger them or tear them down or fuss at them for them being honest with you. So you want to make sure that you have a relationship with them that's going to be nurturing and caring and open to listening and hearing what they're saying, not just hearing to respond, but hearing to actually understand what they're going through. So some early indicators that I see is someone who, again, isolation, extreme isolation, or if you're high functioning, you're just doing everything, and then you have that kind of crash and burn. Like I'm gonna go, and then I'm just gonna have that crash where I can't go anymore. Some people become overachievers or overdo things to overcompensate so that people won't notice what is going on psychologically for them.
We know that those who have less education also have less income, generally speaking, less resources at their disposal to just sometimes meet their basic needs of life. And so that adds additional stress and challenges for them in terms of just being able to maintain and, keep the lights on and things like that. So there is clearly a relationship between education, because there's a connection between education and income, or your means to be able to take care of yourself and your family, and to be able to afford the things that give us a better quality of life. So yes, there's definitely a relationship there. But if you remember, I also showed the slide that showed that regardless of your educational level, depression is increasing across the board for those who have a college education, those who have a high school, and those who don't. So the decline in our overall mental health and well-being, although those who have less education are more prone, and the impact is greater, it's affecting all of us. It has had a lot of impacts, and I'm going to give a story, an example. I talked to a friend of mine who actually is a man who had a baby during he and his wife had a baby during the pandemic. And he described his experience from a man's perspective, and it was horrific. He talked about even the delivery, the birthing process, where they initially they didn't want him to be in with his wife. He had to fight to be in the delivery room as his wife gave birth to their child. They got moved around because they had to be tested, and there were just a lot of changes and experiences that you normally don't have to go through. In other words, from hearing him, it was traumatizing to he and his wife just to give a baby. Deliver a baby, deliver a baby. And so it not only do we see the social isolation in that, usually pregnancy and having a baby is a happy time. You're sharing that experience. You want to share that experience with everybody that all your loved ones. They want to be a part of. They want to be around you. They want to see your stomach as it gets bigger. They want to be there when you have the baby. And during COVID, none of that was possible because, number one, mothers and parents were afraid. They didn't want to expose the mom to contracting COVID. So on a number of levels, it really did affect mothers, and it increased, as I said in the statistics, it increased the depression and anxiety that many women were experiencing. And we already know that postpartum depression is already a high among women, and we always have to look for that postpartum depression. But COVID increased that because of the conditions that women had to go through their pregnancy under, and even their birth and delivery.
I know for for my population, we just try to increase their social engagement in a healthy and safe way, teaching them how to be social and active, but also be safe. A lot of places have mask mandates. The one thing I said is about getting vaccinated. We strongly encourage them to get vaccinated because in a behavioral health world, most facilities, most places you go, you're not going to be able to get into those places if you're not vaccinated. So educating them on that so they know that if you're going to be trying to be in these circles or these areas, that it is in your best interest to be vaccinated for the safety, for your health and safety, and for the safety and health of your children if you have them. Checking in. I know a lot of people, myself included, is like Zoom burnout, but checking in with people, texting people. I'm a technology person, so I every day I get on Facebook and I put a positive message. Every morning I have a group of people that I text a prayer to, just to say, hey, I may not be able to see you, but I'm thinking about you. You know, how are you doing? Let's have a virtual coffee date or something. If you can't be physically with a person, there are ways to do it and make it fun. I have a child who has a group of friends, so when the pandemic first happened, we used to have weekly Zoom calls with them because they were all in school together, but they couldn't see each other. So we would do those things for them to still know, hey, my friends are still here. I can't see them, but I can talk to them.
Yeah, and I think when we talk about suicide, I think really the most important thing is um, removing all of, judgments. And so sometimes it can be a very difficult and hard conversation to ask. But as I shared earlier, the best way is, if you notice someone or that has a history and you notice or you observe a decline in their behavior that might be leading to this direction, the simplest form is to ask them, how are you feeling? And so in mental health, we as clinicians, like Emily said, it's all about checking in. And so checking in is important. And so just simply asking. And then really, when you ask, the most important thing is if they have a plan. And so if they have a plan, the likelihood of them carrying it out is more so than none. And so, are you feeling suicidal? If so, do you have a plan? And if they have a plan, and so sometimes it's getting them help, encouraging to go seek care, seek counseling, go to the doctor. And so there are natural things also that can be done. Oftentimes children now, everything is technology, right? And so getting out, getting in the sun, vitamin D. Vitamin D is a natural vitamin that our bodies produces, but oftentimes African-American people, we have a lack of vitamin D. It's because we're not outside, we're not, and so just to walk in the park or walk up and down the neighborhood. And so that physical activity also helps with someone that may be headed that way or may begin to exhibit those behaviors of being suicidal or imposing some type of self-injury.
And I want to add just a little bit more to that. Sorry. If someone does indicate that they are suicidal and they, as Patrice said, communicate to you that they have thought about it to the extent that they know how they want to commit suicide. And oftentimes, if they're serious, they will have thought it through to that extent. And if you ask, they may not voluntarily tell you, but if you ask, and it's okay to ask, I think we need to ask more questions also of our children, of our loved ones. When we ask, how are you doing? Don't just let them brush you off. and say, oh, I'm okay. No, how are you doing? How are you really doing? What's going on with you? Are you okay? And press them to really tell you how they're really doing. And especially if you see the signs that they appear sad, they appear depressed, you can see that they're not okay, but they're saying, I'm okay. No, press. And it's we, as I'm a clinician also, even though I'm not a practicing RN, I am a registered nurse. It's okay for us to advise them to seek help, professional help. I many times, just in talking to people, say to them, I think you need professional help. You need to seek out some professional help. And oftentimes that's all they need to prompt them, because then they'll say, well, do you know anybody? Can you suggest somebody? And then if it's to the other extreme where they are totally in denial, they're saying, yes, I've thought about killing myself and all this, but I don't think I need help, or I don't want help. And you see that they are seriously considering it, you can intervene on their behalf. And the coroner's office is the go-to place if someone is having is demonstrating the potential to harm themselves or others. If somebody is really suicidal, or you don't have to have proof, but if you have enough information that suggests that that person is suicidal, that they want to harm themselves, or homicidal, they want to harm someone else, you can contact the coroner's office. They will come out and do an assessment. And if need be, they will non-voluntarily commit them so that they get the help they need. And I think it's important for people to know and understand this, because all of these variations are real, and more so now than ever. And we can sometimes intervene just as a regular citizen and save somebody's life. And they may be angry with you at first, but later they will thank you.
And I just want to piggyback off of something that you said, Ms. Alma, about the asking and the saying, okay. I do a feelings check with the clients at least twice a week. And when they say, okay is not a feeling. Mm-hmm. I need a feeling word. And then I'll give them prompts, are you happy? Are you sad? Are you angry? And then I get them to express, what does that mean? What does happiness look like to you? What does sadness look like to you? Because I think a lot of times we don't really understand. We'll say something and we don't understand why we're feeling that way. So getting them to talk about what is prompting them to feel that way, describing that feeling. What does your body feel like inside? What is going on in your mind that's making you feel that way? So having a more robust dialogue about feelings versus just saying, I'm okay. I was that kid. I'm okay. I don't even know what that means.
Right. So the best gift that we can give to our loved ones is to take a few minutes, look them in the eyes and ask them, how are you doing? And really mean it. How are you doing? And give them that space to really tell you how they're doing. Because sometimes all they need is to know that somebody cares about them and how they're doing.
Yeah, most often when children exhibit, and even adults exhibit self-injurious behavior, it can be cutting. And oftentimes children hide their cutting. So the clothes that they wear, long sleeves, oftentimes they may cut in an area on the body that's not as visible. And so And so, you know, those you do more so, you know, when taking your children for physical exams, physical checkups, which should happen is, you know, one way you can, you know, kind of check in as children grow up and they become adolescents. It's kind of hard to do body checks, but and so that's when the communication is so key. Uh, Being observant of the crowds that they're hanging around, because self-injury could look like abusive drug use and, you know, drinking or doing drugs. And so making sure we're in tune with who our children are hanging out with, who they are around, where they're at, what are they doing. And so that is important. And so oftentimes during that adolescence, you will see mood change that happens with your adolescence. And so being attuned is, you know, is key to really, in that, having that open dialogue of communication.
So I'm gonna talk. I'll go first. I've always been very bad with self care, but recently I have been focusing on becoming a better person, inside and out. I have a daughter, so I need to be healthy for her, and I have been rigorously working out. The most I've ever been consistent is going to a workout class very early in the morning, 3 to 4 days a week, and taking time to do something for me without her. I call her my broke best friend, but I have to be my own best friend too. So I try to at least once a week do something totally for me without thinking about her, without thinking about work, without thinking about my husband. Something that I enjoy, even if it's just taking a 4 hour nap.
Yeah, and I think for me, it's, you know, self-care is so important. The National Association of Social Workers just added one of their code of ethics was self-care. And so oftentimes, you know, we're doing the work and we often neglect ourselves. And I just did an article that talked about collective trauma and how do we take care of ourselves being in leadership roles. And so we are, you know, we might not realize it, but we've all endured a type of collective trauma, especially with the COVID-19 pandemic. We may not have experienced it to the level of other people, but we, you know, when I had to lock down, that was a sense of loss for me. I had people that died during that time. That was another sense of loss. So we've all experienced some collective trauma, and being able to take care of ourselves so we can be good for others is important. So I often, you know, I like shopping. And so I did more online shopping. When I was able to get out and walk, you know, getting out in the sun helped me from being locked in. I often like to write. And so I did some, you know, some writing during that time, but we have to be cognizant of our own physical bodies as well so that we can be good for others.
So for me, just being totally transparent, I'm still struggling through it because COVID has changed my life. At one point, I was very anxious about contracting COVID. And so even I was anxious when my own children came around. I have children in their 40s and grandchildren all across the spectrum. And honestly, because they're out and about and moving around and they're more high risk of contracting it and bringing it to me, I was somewhat apprehensive about, and you know, and this is a strange feeling because, you know, your child comes up to you and they want to hug you and you're going, where's your mask? You know, it's just, you know, kind of bizarre, but it's real. I mean, we've gotten past that because they've gotten vaccinated and all of that. So it's not as bad, but last year was very stressful and I felt very isolated and I didn't do a lot of the normal routines like, you know, big family Thanksgiving, big family Christmas, you know, because I'm thinking I don't want to be around that many people. And so a lot of changes, it affected me a lot. And also, I realized, the disruption in the work space and work environment made things more difficult to get things done. It added additional stress and pressure to, change the way we normally work. It on so many levels, there was just a lot, and it did add more stress. I'm a very high energy. I don't look like it, but I am a high energy, kind of, I like to get things done. and I had to adjust to having to not be able to do as much, because it took more effort and energy to do just the normal routine things. I had to set boundaries and limits and learn how to say, no, I can't do that, or I can't do it right now, or I've got too much on my plate, or I'm already maxed out. So and I'm still adjusting. And on top of all that, I got married. And so that's another responsibility in addition, which has been good actually in most ways, as far as helping me to cope and helping me to slow down and helping me to, have support. But yes, it is real as far as the impact on us as women. And I know that we all experience it different ways, but yes, it does impact all of us, I believe, in some way.
Thank you all. I have personally thoroughly enjoyed all of the wonderful information that was shared by each of our presenters, and I just want to thank you all for all that you do. Actually, for all that you do, and I heard someone say mental health is a part of your health, and that it's important that we ensure the state of our well-being is healthy. And the first step toward that is self-care, that we have to take care of ourselves first so that we can be of help and assistance to others. And so we definitely have to make sure that we are doing the necessary things to make sure that we are taking care of our mental health. And it's important that we are intentional with the people that are around us, that it's not enough to say, oh, I'm okay. Thank you, Emily, for that. I'm okay is not a feeling. And to get people to be more expressive about how they are feeling, and especially our children, especially our sisters. And so I just want to say a special thank you to Dr. Bester and to her team, to the Southern University Law Center. Thank you so much for supporting us in these efforts. I also just want to take my hats off to all of the presenters, Dr. Patrice, Mrs. Allen, and I say that because she's newly married, so that's her new name, Mrs. Allen. And Emily, I want to thank you as well. I also want to say a special thank you to our moderator. Thank you so much, Vanya, for agreeing and accepting our invitation to moderate. We appreciate everything that you've done to help us to pull this off. And I also want to say a special thank you to the members of the National Congress of Black Women that are part of helping to organize this webinar. But I do especially want to thank just all of you. I would love to keep this conversation going. I'm hoping that we can plan a part 2 to this, because I think that this is a worthwhile and necessary conversation. And I just want to say we're going to bruise the devil's head for trying to get into this. And but I think, y'all, everything that we were able to share, and even being able to share the video with the other participants that registered. But I would love if we can plan a part 2 to this conversation. So we'll check with everybody, see where you are, perhaps sometime in December as we approaching Christmas or something like that, perhaps we can give people some tools as they move into the holidays. And you already know that that comes with its own issues, you know, there. So, but again, thank all of you. I want to say a special thank you also to Carrie, who is I'll call her our marketing coordinator, who actually helped to promote this event. Carrie, thank you so much, even for joining us. So at this time, Dr. Bester, I know you would like to share a few pointers before we end, but again, thank you from the bottom of my heart. I truly appreciate all of you. Thank you so much. Dr. Bester.
Thank you so much, Dr. Bird. I just want to acknowledge the partnership between the National Congress of Black Women, the Louisiana Center for Health Equity, and Southern University Law Center's Vulnerable Communities and Peoples Initiative. I thank you for your collaboration as always, and I want to thank every participant, and I thank every one of our presenters. And again, Vanya, welcome to Louisiana, welcome to Baton Rouge. I think I said to you on yesterday that you belong to us now. So you got lots of sisters and brothers to reach out to. And please, I mean that sincerely. We are here for you, for anything that we can do to make your transition into Louisiana, into Baton Rouge, easier. I want to encourage everyone. You guys know that this is a part of who I am. If you have not yet voted, please go out and vote today before 8 p.m. Don't wait till 8 p.m. because I know some of y'all are going to the game. So y'all go ahead and get y'all some breakfast and go out and vote. Vote like your life depends on it, because it does. Thank you so much. Thanks to everybody for joining. And let me just please apologize once more for the technical difficulties that we had. We promise that next time we'll do a better job of giving you a better experience. So go out and have a great day, and thank you, thank you, thank you.
Thank you.